Stacey West, and I will be speaking with you concerning the benefits of breastfeeding. Did you know the American Academy of Pediatrics firmly adheres to the position that breastfeeding ensures the best possible health, development, and psychosocial outcomes for the infant? And did you know there are at least 100 ingredients contained in human milk that are not found in formula, and that although they may have claim to added ingredients, they may not be absorbed the same way as when consumed through human milk? The advantages gained by breastfeeding greatly outweigh the disadvantages. Although there are many benefits associated with breastfeeding, I would like to focus on just 2 of these today. First, I will discuss the benefits provided to the breastfed infant that a formula-fed infant may not receive, and also point out the economic benefits breastfeeding may provide to the family as well as to society. A well-known health benefit provided by breastfeeding is the presence of antibodies. Colostrum, which is produced during the first few days postnatal, contains the highest concentrations of antibodies. Most people believe these antibodies diminish as the colostrum transitions into mature milk. However, although the concentrations of antibodies does change, the amount of antibodies the infant receives throughout lactation remains relatively constant. The mother's body will produce antibodies to fight viruses and infections with which she comes in contact and transfer these antibodies through her breast milk to the infant. In addition to antibodies, human milk also contains non-antibody factors that protect against bacterial infections. Here I have compiled a list of several diseases, infections, and conditions that studies have shown breastfeeding may aid to prevent or result in lower occurrences and or decreased severity. Breastfeeding is known as the best protection against sudden infant death syndrome. Studies show lower rates of occurrence of obstructive sleep apnea, or OSA, among individuals who were breastfed as infants. Breastfeeding ensures the proper development of the teeth and shaping of the hard palate, whereas the use of artificial nipples can cause a high palate, narrow dental arches, and overbites, which are symptoms of OSA. The soft breast conforms to an infant's mouth, while firm nipples require the mouth to do the conforming. OSA can have severe health and economic consequences, and experts say exclusive breastfeeding is the best prevention. Obesity is a growing health concern in our nation today. Several studies conducted have obtained results with clear evidence that breastfeeding lowers the risk of being overweight during childhood and may also reduce the risk as an adult. One reason may be that breastfed infants learn to control the amount of milk and calories they consume better than bottle-fed infants, who are often urged to continue feeding and finish a bottle even after they have been satisfied. Some parents would pay large amounts of money in order to guarantee the best health and development of their child. Breastfeeding can give this guarantee and even provide economic savings to the family. Breastfeeding can Although additional food is needed for the lactating mother, the cost of formula may be 3 times the cost of extra food. Because the breastfed infant experiences fewer incidences of illness, the parent will miss less work and not lose wages in order to care for the sick child. And savings would also result from fewer visits to the doctor and fewer prescription drugs. Many studies have been done to estimate the amount of money that could be saved by the government if there was an increase in the number of women who chose to breastfeed. The Women, Infants, and Children Program, or WIC, is a government program that provides formula and other nutritional products for mothers who are financially unable to do so. The rate of breastfeeding is the lowest among WIC recipients. This graph shows the difference in the number of women who breastfeed and participated in the WIC program and the number of women who breastfeed and do not participate in the WIC program. Keep in mind the rates shown here are in-hospital rates, meaning at the time of discharge, the mother was primarily breastfeeding. And this graph shows the percentage of WIC recipients that breastfeed in hospital compared to the percentage of those who are still breastfeeding at 6 months. As you can see, these rates have tremendously dropped. The U.S. Surgeon General has set a goal that by 2010, 75% of women would breastfeed postpartum, and at least 50% of them were continuing to do so at 6 months. If these goals were achieved among WIC recipients, the cost savings could be at least $4 million a month for the WIC program alone. Another government program that could see large savings due to an increase in breastfeeding is the Medicaid program. fewer visits to the doctor and emergency rooms, less prescription medications, and a decrease in infant morbidity due to the health benefits breastfeeding provides would result in much lower Medicaid expenditures. Several factors have contributed to the decline of breastfeeding, including lack of education, marketing by formula companies, the portrayal of bottle feeding as the normal, maternal employment, and acceptance from family and/or society. In spite of this, the many health advantages provided to the infant and the economic benefits that have the potential to significantly impact our society greatly outweigh the disadvantages. Many well-respected health experts, including the American Association of Pediatrics, the American Diabetes Association, the USDA, the U.S. Surgeon General, and the World Health Organization agree that breastfeeding is the superior feeding method and are working to increase education about breastfeeding. Are there any questions?
Yes, what can be done to increase the number of women who choose to breastfeed?
I believe two things need to happen. We need to increase education regarding the benefits and change the image of breastfeeding as abnormal. I feel that breastfeeding education should be offered by the obstetrician and also be made part of prenatal classes such as Lamaze. And hospitals should also be required to staff lactation consultants to be available to the mother during the first few days, which is a critical time to ensure the success of breastfeeding. If more women were made aware of all the potential health benefits, they would be able to make a more informed decision. In our society today, bottle or formula feeding is viewed as the normal feeding method. Contributing to this are the mass marketing efforts of the formula manufacturers through their TV ads, coupon mailings, and hospitality packages given to mothers in hospital. We even grow up feeding our baby dolls bottles. Experts agree in order to increase breastfeeding numbers, promotion and education are key. Anything else?
Approximately how much money can be saved by breastfeeding versus purchasing formula?
Technically, the savings is unknown because it cannot be said how many viruses, infection, and/or diseases breastfeeding may prevent during childhood and then on into adulthood. The more calculable savings is the money spent on purchase of formula. This savings could range from $1,500 to over $3,000 depending on the type of formula the infant consumes.